Hi friends, welcome back. I am here to bust myths and bring you evidence-based information so you can feel confident in your postnatal body. Today we are answering a really common question: why do I have lower back pain after having a baby? And more importantly, what is actually going to help? So let's get into the science. First, I would like to make one thing clear. Having lower back pain after pregnancy does not mean you are moving wrong, that you're weak or out of alignment. Your body has gone through a massive physical, hormonal, and lifestyle change, and pain is often a byproduct of adaptation, not damage. A 2018 review found that lower back pain and pelvic girdle pain are extremely common postpartum, with prevalence of around 43% in the first months. But crucially, they noted that no single posture, movement, or muscle imbalance explains the pain. Why? Because your movement patterns have changed, not because they're wrong, but because your context is different. After birth, your body is adapting to new feeding positions, long periods of sitting, rocking, carrying, sleep disruption, a sudden spike in load from lifting and holding your baby, hormonal shifts, and obviously healing from birth. None of these mean you're broken, but they do mean that you are using your back differently, and sometimes that new pattern becomes sensitive. Relaxin often gets blamed for loose joints or back pain, but research doesn't support this. Multiple studies show that relaxin levels do not predict back pain. Relaxin isn't strongly correlated with joint laxity. Ligament looseness is normal and adaptive. So it's not that relaxin makes you unstable or put you in danger. It's that your body is adjusting to new loads and movement demands. Now, many people assume their back hurts because their core is weak, but a well-known paper highlights that there is no evidence that a weak core causes back pain, that no single muscle group prevents or predicts pain, and the body works as an integrated system, not isolated parts. Postnatally, your abdominal and pelvic floor system is in a recovery phase, not a dysfunctional one. And another study found that diastasis recti does not predict back pain postpartum. Your core is not broken, it is reorganizing. So what are the real contributors to postnatal back pain? Current evidence suggests several overlapping factors. Load mismatch, so your back is suddenly lifting, carrying, and bending far more than pre-birth. It's not weakness, it's deconditioning meeting increased load. Fatigue and sleep disruption. Multiple studies show sleep deprivation increases pain sensitivity and slows recovery. Repetitive postures, feeding positions, pram pushing, rocking, prolonged repetition can make certain tissues sensitive. Stress and cognitive load. Postnatal mental load matters. A 2020 study found that stress strongly influences musculoskeletal sensitivity and general recovery from birth, whether vaginal or C-section. Healing affects movement patterns for a while. Now, none of these equal injury. They equal a life change. So what will actually help during this phase of life? Gentle, progressive strength training. A 2018 random controlled trial found that postpartum exercise, including strength training, significantly improved pelvic and lower back symptoms. Strength restores confidence, increases tolerance to lifting your baby, and reduces tissue sensitivity. So start with bodyweight squats, hip hinges, light rows, gentle core work. You also need gradual exposure to normal movement. So you don't need perfect technique, you need safe and progressive load. As Lederman reminds us, movement variability builds resilience. Now this one might surprise you, but you need more movement, not less. A 2019 study found that postpartum walking programs reduced back pain and improved well-being. Short, frequent movement is very powerful. Improve sleep where you can. Not easy with a baby, obviously, but research clearly links sleep with reduced pain sensitivity. Even small improvements matter. Sharing night feeds, short daytime naps, lowering other stressors. Reducing fear and increasing confidence. Catastrophizing or worrying that movement equals damage has a huge impact on pain. A 2021 study showed that fear of movement was a stronger predictor of ongoing pain than actual physical changes. When you stop fearing movement, you might actually find some improvement. And seeing a physio if symptoms persist, especially if pain is lasting over 3 months, you have nerve symptoms, or it is impacting your daily life. A physio using a biopsychosocial approach, not a your core is weak approach, can help you build tolerance safely. Your postnatal back pain does not mean your core is broken, your posture is wrong, your body is unstable, relaxin ruined your ligaments, or you are moving incorrectly. This is a very normal experience for a lot of postpartum folk, and it means your body is adapting, healing, and learning new movement patterns whilst under new loads. You're not moving wrong, you are moving differently. And with gradual strengthening, load management, and compassion for your postpartum body, things can improve massively. If this helped you understand your postnatal body a little better, please feel free to share it with someone who you think might need it too. And remember, it's your body, your choice. I'm just here to help you make informed ones.